Welcome to Explain Wise 91, the channel where nursing concepts are broken down simply, clearly, and smartly. If you're preparing for the Nclex and struggling with priority questions, the kind that decide pass or fail, you're in the right place. In today's video, we're tackling high-stakes Nclex priority questions that nurses commonly get wrong, focusing on emergency situations, critical thinking, and what the Nclex really wants you to choose. Watch closely, think like a nurse, and let's master Nclex priorities together. Question 1. A client with chest pain is admitted to the ER. Which action should the nurse take first? A. Obtain a full health history. B. Administer oxygen. C. Insert an IV line. D. Obtain a 12-lead ECG. Correct answer. B. Rationale. Oxygen improves myocardial oxygenation immediately and prevents tissue damage. Strategy. ABCs first. Airway and breathing always come before diagnostics. Question 2. A post-operative client suddenly becomes short of breath and anxious. What is the nurse's priority action? A. Notify the provider. B. Raise the head of the bed. C. Obtain vital signs. D. Administer pain medication. Correct answer. B. Rationale. Elevating the head of the bed improves ventilation and oxygenation immediately. Strategy. Fix positioning before calling or assessing. Question 3. A client with head injury has a sudden decrease in level of consciousness. What should the nurse do first? A. Check pupil response. B. Notify the provider. C. Assess airway patency. D. Obtain a CT scan. Correct answer. C. Rationale. Airway compromise is life-threatening and must be addressed immediately. Strategy. Airway always beats neurochecks. Question 4. A client with sepsis has BP 78/40 millimeters mercury. What is the nurse's priority action? A. Administer antipyretics. B. Start IV fluids. C. Obtain blood cultures. D. Give antibiotics. Correct answer. B. Rationale. Hypotension threatens perfusion. Fluids restore circulation first. Strategy. Circulation before medications. Question 5. A client receiving IV potassium reports burning at the IV site. What should the nurse do first? A. Slow the infusion. B. Stop the infusion. C. Assess IV patency. D. Notify the provider. Correct answer. B. Rationale. Potassium is caustic. Infusion must be stopped immediately to prevent tissue injury. Strategy. Stop the harm before assessing. Question 6. A client with diabetes is confused, sweaty, and shaky. What is the priority action? A. Check blood glucose. B. Administer insulin. C. Give oral glucose. D. Notify the provider. Correct answer. C. Rationale. These are signs of hypoglycemia. Immediate glucose is life-saving. Strategy. Treat hypoglycemia before confirming. Question 7. A client has a potassium level of 6.8 milliequivalents per liter. What finding is most concerning? A. Muscle weakness. B. Nausea. C. Tall peaked T waves. D. Fatigue. Correct answer. C. Rationale. Hyperkalemia causes lethal cardiac dysrhythmias. Strategy. Cardiac rhythm equals priority. Question 8. A client suddenly develops stridor after receiving antibiotics. What should the nurse do first? A. Administer epinephrine. B. Stop the medication. C. Apply oxygen. D. Notify the provider. Correct answer, A. Rationale. Stridor indicates airway obstruction from anaphylaxis. Epinephrine saves lives. Strategy. Treat airway emergencies immediately. Question 9. A burn client has dark cola-colored urine. What complication is suspected? A. Dehydration. B. Renal failure. C. Myoglobinuria. D. Infection. Correct answer, C. Rationale. Muscle breakdown releases myoglobin, which can damage kidneys. Strategy. Think rhabdomyolysis in burns. Question 10. A client with asthma is using accessory muscles to breathe. What is the nurse's priority action? A. Administer bronchodilator. B. Obtain peak flow. C. Encourage coughing. D. Give oral fluids. Correct answer, A. Rationale. Bronchodilators relieve airway constriction immediately. Strategy. Fix breathing before measuring. Question 11. A client receiving a blood transfusion develops chills, fever, and back pain. What should the nurse do first? A. Slow the transfusion. B. Stop the transfusion. C. Administer acetaminophen. D. Notify the provider. Correct answer, B. These symptoms indicate a possible hemolytic transfusion reaction. The transfusion must be stopped immediately to prevent further complications. Strategy: stop the source of harm first. Question 12. A client arrives at the emergency department with suspected stroke symptoms that began 45 minutes ago. What is the priority action? A. Administer aspirin. B. Perform a neurological assessment. C. Obtain blood glucose. D. Obtain a CT scan. Correct answer, D. A CT scan is required to differentiate ischemic from hemorrhagic stroke before treatment. Strategy: imaging before intervention. Question 13. Which finding in a client with increased intracranial pressure, ICP, is most concerning? A. Headache. B. Nausea. C. Widening pulse pressure. D. Photophobia. Correct answer, C. Widening pulse pressure is a late sign of increased ICP and impending herniation. Strategy: late signs equals emergency. Question 14. A client is found unresponsive with pinpoint pupils and slow respirations. What is the nurse's priority action? A. Check blood glucose. B. Administer naloxone. C. Apply oxygen. D. Start IV fluids. Correct answer, B. These are classic signs of opioid overdose. Naloxone reverses respiratory depression. Strategy: reverse life-threatening cause immediately. Question 15. A chest tube becomes disconnected from the drainage system. What should the nurse do first? A. Clamp the chest tube. B. Notify the provider. C. Place the tube end in sterile water. D. Apply oxygen. Correct answer, C. Placing the tube in sterile water creates a temporary water seal to prevent air entry. Strategy: prevent pneumothorax first. Question 16. A client with a new tracheostomy suddenly becomes cyanotic and the tube is dislodged. What is the nurse's first action? A. Ventilate with a bag mask. B. Reinsert the tracheostomy tube. C. Call a rapid response. Or D. suction the airway. Correct answer is A. Rationale: oxygenation is the priority when the airway is compromised. Strategy: oxygen before procedures. Question 17. Which finding in a client with diabetic ketoacidosis, DKA, requires immediate intervention? A. Fruity breath. B. Blood glucose 450 milligrams per deciliter. C. Kussmaul respirations. Or D. Polyuria. Correct answer is C. Rationale: Kussmaul respirations indicate severe metabolic acidosis. Strategy: acid-base imbalances are life-threatening. Question 18. A trauma client arrives with suspected spinal cord injury. What is the nurse's priority action? A. Obtain vital signs. B. Immobilize the cervical spine. C. Insert a urinary catheter. Or D. Administer pain medication. Correct answer is B. Rationale: preventing further spinal damage is critical. Strategy: protect the spine first. Question 19. Which symptom in a post-operative client is most indicative of a pulmonary embolism? A. Sudden shortness of breath. B. Low-grade fever. C. Productive cough. Or D. Chest tightness with movement. Correct answer is A. Rationale: sudden respiratory changes equals emergency. Question 20. A client develops stridor after thyroid surgery. What does this indicate? A. Pain. B. Infection. C. Hypocalcemia. Or D. Airway obstruction. Correct answer is D. Rationale: stridor signals airway compromise from swelling or bleeding. Strategy: neck surgery equals airway risk. Question 21. A client is actively seizing. What is the nurse's priority action? A. Insert an oral airway. B. Protect the client's head. C. Administer IV medication. D. Obtain vital signs. Correct answer is B. Rationale: safety is the priority during an active seizure. Strategy: protect before you treat. 22. A burn client has urine output of 15 milliliters per hour. What should the nurse do first? A. Increase IV fluids. B. Insert a Foley catheter. C. Notify the provider. D. Administer diuretics. Correct answer is A. Rationale: low urine output indicates inadequate perfusion. Strategy: fluids prevent shock. 23. Which finding indicates hypocalcemia? A. Bradycardia. B. Hypertension. C. Trousseau sign. D. Decreased reflexes. Correct answer is C. Trousseau sign is a classic sign of low calcium levels. Strategy: tetany equals hypocalcemia. 24. After cardiac catheterization, bleeding is noted at the insertion site. What is the first action? A. Apply a pressure dressing. B. Apply firm manual pressure. C. Notify the provider. D. Check vital signs. Correct answer is B. Rationale: immediate pressure prevents hemorrhage. Strategy: stop bleeding first. 25. A client on heparin therapy develops bleeding gums. What is the nurse's priority action? A. Hold the next dose. B. Administer vitamin K. C. Check APTT. D. Notify the provider. Correct answer is C. Rationale: APTT evaluates heparin effectiveness and bleeding risk. Strategy: assess before acting. Question 26. A client has an INR of 6.2. What complication is the nurse most concerned about? A. Infection, B. Stroke, C. Hypertension, D. Hemorrhage. Correct answer, D. Rationale. Elevated INR significantly increases bleeding risk. Strategy. High INR equals bleed risk. Question 27. A client receiving tube feedings begins coughing and choking. What should the nurse do first? A. Stop the feeding. B. Suction the airway. C. Check tube placement. D. Notify the provider. Correct answer, A. Rationale. Stopping the feeding prevents aspiration. Strategy. Stop the threat first. Question 28. A post-operative client reports calf pain and swelling. What complication is suspected? A. Infection, B. Muscle strain, C. Deep vein thrombosis, D. Fluid overload. Correct answer, C. Rationale. Calf pain and swelling are classic signs of DVT. Strategy. Clots can kill. Act fast. Question 29. Which assessment finding suggests a tension pneumothorax? A. Crackles, B. Tracheal deviation, C. Dull percussion, D. Bradycardia. Correct answer is B. Tracheal deviation is a late life-threatening sign. Rationale. Tracheal deviation is a late life-threatening sign. Strategy. Deviated trachea equals emergency. Question 30. Before administering insulin, what must the nurse check first? A. Blood glucose, B. Blood pressure, C. Potassium level, D. Temperature. Correct answer is A. Rationale. Insulin dosing is based on current blood glucose. Strategy. Verify before you give. Question 31. A client with acute pancreatitis is admitted. What is the priority intervention? A. Administer antibiotics. B. Keep the client NPO. C. Encourage oral fluids. D. Provide a high-fat diet. Correct answer is B. Rationale. NPO status reduces pancreatic stimulation. Strategy. Rest the organ. Question 32. A hypoglycemic client is unconscious. What is the nurse's first action? A. Give oral glucose. B. Administer insulin. C. Give glucagon IM. D. Administer IV dextrose. Correct answer is D. Rationale. IV dextrose rapidly corrects hypoglycemia in unconscious clients. Strategy. Unconscious equals IV route. Question 33. A client presents with vomiting blood. What is the priority assessment? A. Vital signs. B. Abdominal pain. C. Medication history. D. Bowel sounds. Correct answer is A. Rationale. Hemorrhage can lead to shock. Strategy. ABCs always. Question 34. A client presents with fever, headache, and neck stiffness. What condition is suspected? A. Migraine. B. Encephalopathy. C. Meningitis. D. Stroke. Correct answer, C. Rationale. Classic triad of meningitis requires urgent treatment. Strategy. Infection plus neuro equals isolate fast. Question 35. A client's oxygen saturation drops to 86%. What is the nurse's first action? A. Notify the provider. B. Apply oxygen. C. Obtain ABGs. D. Reposition the client. Correct answer, B. Hypoxia must be corrected immediately. Strategy. Oxygen first. Question 36. A post-operative client suddenly becomes restless and short of breath. What should the nurse suspect first? A. Atelectasis. B. Anxiety. C. Pulmonary embolism. D. Pneumonia. Correct answer, C. Rationale, sudden onset suggests embolism. Strategy, sudden equals deadly. Question 37. Which finding indicates magnesium toxicity? A. Hypertension. B. Hyperreflexia. C. Tachycardia. D. Loss of deep tendon reflexes. Correct answer, D. Loss of reflexes is an early sign of magnesium toxicity. Strategy, reflexes equals magnesium monitor. Question 38. Which assessment finding indicates worsening heart failure? A. Crackles in lungs. B. Bradycardia. C. Dry cough. D. Weight loss. Correct answer, A. Rationale, crackles indicate fluid overload. Strategy, lungs show fluid status. Question 39. Which finding is most indicative of bowel obstruction? A. Constipation. B. Vomiting. C. Diarrhea. D. Flatulence. Correct answer, B. Rationale. Vomiting occurs as intestinal contents back up. Strategy. Obstruction backs things up. Question 40. The primary goal during the first 24 hours after a major burn is A. Pain control. B. Infection prevention. C. Fluid resuscitation. D. Wound healing. Correct answer, C. Rationale. Fluid loss can lead to hypovolemic shock. Strategy. First 24 hours equals fluids. Question 41. Which symptom suggests digoxin toxicity? A. Yellow-green vision. B. Hypertension. C. Increased appetite. D. Weight gain. Correct answer, A. Rationale. Visual disturbances are classic for digoxin toxicity. Strategy. Vision changes equals digoxin. Question 42. Which is an early sign of internal bleeding? A. Hypotension. B. Bradycardia. C. Decreased urine output. D. Tachycardia. Correct answer, D. Rationale. Tachycardia is a compensatory response to blood loss. Strategy. Heart rate rises first. Question 43. After tonsillectomy, which finding requires immediate intervention? A. Mild throat pain. B. Excessive swallowing. C. Decreased appetite. D. Low-grade fever. Correct answer, B. Rationale. Excessive swallowing indicates bleeding. Strategy. Swallowing equals bleeding. Question 44. A client receiving opioid analgesics requires monitoring of which parameter first? A. Blood pressure. B. Temperature. C. Respiratory rate. D. Pain level. Correct answer, C. Rationale. Opioids depress respirations. Strategy. Breathing before comfort. Question 45. A client with hypovolemic shock requires which intervention first? A. Rapid IV fluids. B. Blood transfusion. C. Vasopressors. D. Oxygen therapy. Correct answer, A. Rationale. Restoring circulating volume is the priority. Strategy. Volume before drugs. Question 46. A client with heat stroke is admitted. What is the nurse's priority action? A. Administer IV fluids.
B. Initiate rapid cooling. C. Obtain lab work. D. Give antipyretics. Correct answer, B. Rationale: lowering core temperature prevents organ damage. Strategy: cool first. Question 47. Which assessment finding indicates metabolic acidosis? A. Slow respirations. B. Shallow breathing. C. Deep rapid respirations. D. Decreased heart rate. Correct answer, C. Rationale: Kussmaul respirations compensate for acidosis. Strategy: lungs compensate for pH. Question 48. A child is choking but coughing forcefully. What should the nurse do? A. Perform abdominal thrusts. B. Call a code. C. Suction the airway. D. Encourage coughing. Correct answer, D. Rationale: effective coughing indicates a patent airway. Strategy: coughing equals don't intervene.
Question 49. Which finding suggests post-operative urinary retention? A. Bladder distension. B. Low urine-specific gravity. C. Dark urine. D. Frequent urination. Correct answer, A. Rationale: distension indicates inability to void. Strategy: feel the bladder. Question 50. A client with septic shock requires which intervention first? A. Broad-spectrum antibiotics. B. IV fluid resuscitation. C. Vasopressors. D. Antipyretics. Correct answer, B. Rationale: fluids restore perfusion and prevent organ failure. Strategy: circulation before medication. You just reviewed some of the most important Nclex priority questions every nurse must understand. Remember, Nclex isn't about memorizing answers, it's about thinking safety, priority, and life-saving decisions. If this video helped you think more clearly and confidently, don't forget to like, share, and subscribe to Explain Whys 91 for more Nclex mastery content. Drop your questions in the comments, stay consistent, and trust the process. You are closer to becoming a registered nurse than you think. See you in the next video.